Well, hello everybody. This is Chris, Pastor Chris RN, and we are going to talk today. Um, I don't know if it started or not, but this is Chris at Pastor Chris RN. Today we are going to be talking about stroke prevention and treatment, and I'm going to try to focus for those of you who watch this live stream on those of you who maybe live in areas, especially areas in the world, without ready and quick access to healthcare, and certainly not all the advanced treatments that may be there in bigger cities. So today we'll jump into it. We'll talk about that today. I do want to make a mention for those of you in Africa. I really wish I could go this year, but I did see there was and I'm going to post in the comments here. There is a conference in Kenya. Kisumu, I think is how you pronounce it. Um, there is a conference in Kenya that is focused on palliative care and hospice. I want to give a shout out to that. I think that's great work. I think it's the sixth annual conference. It's good to see on the continent of Africa that there are organizations such as this that are working towards helping patients at the end of life. So I just posted that link in the comments, so I'd encourage you to check it out. So let's talk a little bit about strokes. And this morning, so I've had a stroke, and I was blessed to be near a hospital, and I went in right away as soon as I experienced symptoms, and I was able to get treatment really early on. I got clot busting medicine to break up the clot that had gone into my brain, and because of that, the damage was minimal. But I was thinking this week as I was getting ready for this live stream, I was thinking about the fact that a lot of people, a lot of you who may be watching this, don't have ready, quick access to the most advanced, best kind of healthcare available. So when you start to have stroke symptoms, you may not be able to get to a hospital that has the right kind of care in a timely manner. So with that in mind, I want to kind of go through and talk about strokes. One of the things that I learned as I was getting ready is globally, strokes are the second leading cause of death, and many people are disabled globally with stroke. And it's interesting, I saw that in emerging, developing economies, that stroke is really becoming more and more prevalent. And that really got my attention. And I thought about that a lot. Is the reality is that as medicine advances and as people become more and more aware of the kinds of treatments that are out there, it's really hard to be in an area in the world. We've got a lot of people following this page from Pakistan, and a number from Malawi and Kenya and Nigeria and Ghana, many countries where there is this emerging healthcare system, and there's emerging economies, and people are availing themselves of that more and more. Well, some of the unhealthy habits that the West has had is getting exported to these other countries, and that leads to, I think, some increase in stroke. So, what is a stroke? A stroke happens when blood flow is restricted in some way to the brain. It can happen two different ways. One way is an ischemic stroke, and that's kind of what happened to me. I had a blood clot that got into my carotid artery. It went up and blocked and restricted some blood flow. Thankfully it was a really small clot to my brain, and because of that, there's a little dot in the imagery, MRI imagery, where you can see where that blood clot had blocked the flow to my brain, and some of the tissue right there, the other end of that clot, where the blood couldn't get to that tissue, it killed part of the brain tissue. So ischemic, you think about ischemic is blocking the blood so it can't get to the brain. Then we have hemorrhagic strokes, and those are the kinds of strokes where the brain, the blood vessels in the brain start to leak or bleed. And a hemorrhagic stroke is just the blood starts spilling out into the brain tissue, and that can also cause damage to the tissue. So when you have a stroke, what's happening is your brain is not getting the oxygen that it needs. It's not getting the blood that it needs, either because the blood vessels have ruptured or they're blocked, and when that happens, the tissue starts to die. And when the tissue dies, depending on where it is in the brain, it is going to kill certain functions. And because of that, for example, with my stroke, I have this hand, my right hand, I have tingling that is always there. I can use my hand, but I've got tingling in it. I'll always feel that. It's been 4 years since I've had my stroke, and I still have tingling in my hand. And so you'll find with the stroke, what's happening with people and why it's so dangerous is depending on where the tissue is damaged in your brain will affect the kinds of functionality that you'll lose. And you'll often see people with significant strokes that survive. They may be paralyzed on one side of their body. They may lose their ability to swallow. They may lose their ability to communicate. And so all these things can happen when you have a stroke. And one of the reasons why we want to think about preventing stroke is that damage can happen very quickly. And if you don't have access to the kind of treatment that you need to help minimize the damage, you could survive with a lot of deficits. And you maybe know someone who's had a stroke and has had a lot of deficits. And because of those deficits, they require a lot of care for the rest of their life. And so we really want to be thinking about what can we do to prevent a stroke from happening? How do we prevent these things? But before we can do that, we have to start asking the question, what is it that is going to be risk factor? I mean, what things can cause strokes? What are the risk factors? And there are a number of them, and there's some, I just want to talk about each one of them for a few minutes. Some factors are things that we can't do anything about. For example, age. If you're over age 55, anyone over age 55 has double the risk of having a stroke. Sex. Females, especially under the age of 55, are more at risk than males. Over the age of 55, males are slightly more at risk than females. What about race and ethnicity? one of the things that they found in these studies, especially for those of you in Africa, is that African races that have come out of Africa, had their origination in Africa, actually are a higher risk of stroke than races that are originated in Europe. And it looks like China is the place, the people with the highest risk of stroke. There's another thing that can happen called a TIA, transient ischemic attack. It's not a stroke. Some people call it a mini stroke, and people can have those. It's like a tingling in the head, or a vacant stare, just kind of staring off to space. But if you've had a TIA, if you have those moments where you're tingling, your head's numb, you know, people say that you kind of went off into space somewhere, you weren't really responding. If you've had that, then what ends up happening is you end up being more at risk. So if you've had a TIA, there's nothing you can do about it. You're more at risk for having a full-blown stroke. The other thing is that stroke tends to run in families. So if you've had a father and a grandmother and a great-grandmother, a great-great-grandfather, if you look in your family history and if you see that a lot of people are having strokes or have had strokes, then the risk for stroke is higher. And one of the ways, and I just want to jump back, and sometimes it helps to help people be more aware of these factors, to say, look, I'm at higher risk of stroke, so let me have some kind of plan in place and some kind of awareness of symptoms that if I all of a sudden I'm feeling numbness on one side of the body, if I start to have difficulty talking and communicating, if my blood pressure is through the roof, those kinds of things, that if I know I'm already at a risk factor and I see some of these things starting to happen, I know I've needed to act quickly. And I would, as best you have access, anybody that's at a super high risk, or especially with the genetic component, you have lots of relatives who've had a stroke, is I would do my best to get with a healthcare provider and go over and talk about that and come up with a plan, because especially in areas with limited access, and I would suggest this just as an aside, when you have limited access to healthcare, you want to maximize the time that you would have when you see a provider, right? So I would go through all these things, and if you watch these live streams, we're going to be talking about a lot of different health conditions as you begin to help, especially if those of you who are trying to help people in your community. Help them write down the things that they're at risk for. Help people understand all those things that they need to talk to a healthcare provider about, so that when they do go to something that's not as frequent, and maybe medical care isn't as often available in their community, that they'll have a list, they'll have things written down, and they'll be able to have a discussion with that healthcare provider to get some ideas about treatment. But we want to think about these risk factors that we really can't do anything about. But there are risk factors that we can do something about. One is hypertension, and there's a huge connection between hypertension. That means your blood pressure is too high. And the way to think about this is, the more restricted the flow is of blood in your body, the harder that heart has to pump to get that blood to go everywhere in your body. And so when you have hypertension, you have a situation where the heart is having to pump really, really hard to force that blood through your body. And when it's pumping really, really hard to force that blood through your body, your pressure goes up. And the more pressure that you have on your arteries, the more likely they can rupture and burst. And that is a big factor. That's what's behind a lot of hemorrhagic strokes, is simply your blood pressure has gotten way, way too high. And because it's way, way too high, it is going to burst maybe some blood vessels in your brain. And when that happens, you have a stroke and your brain is damaged. So one of the big risk factors that we can do to reduce stroke risk is to manage our blood pressure. And as I was doing research, I realized in many places we've got a big audience in Africa. And one of the things that I would want to share with my African friends is that there is increasing risk and incidence of hypertension in your part of the world. And any access you have to a healthcare provider would be good to manage and get medication to treat hypertension, high blood pressure, to take that pressure off of your blood vessels so there would be less chance that they would burst, especially inside your brain. Another known risk factor is tobacco use, smoking. Smoking is a known factor, so if you smoke, you have a higher risk of having a stroke. Another one is alcohol and drug abuse. People, again, there is a connection between people that use too much alcohol or use a lot of different illegal drugs like cocaine, amphetamines, things like that, that will lead to increased prevalence of stroke. Another one, and this is especially, I think, is going to affect people, especially if you're an emerging economy. Maybe you've had the benefit of getting college or education and training, and instead of working in a field like your parents and grandparents and great-grandparents did and doing agriculture or hunting or whatever they did way back, you're finding yourself working in an office somewhere. You're not doing manual labor, you're not building. And so because of that, you spend most of your time, like I do, I spend a lot of my time behind a desk. I'm not in a career field. When I was nursing bedside in a hospital, oh yeah, there was a lot of physical exertion there, but a lot of what I'm doing now, there's not quite as much physical exertion. And because of that, lack of physical exertion, I have more inactivity, which again is something that will increase my risk of stroke. And so I would encourage anybody that has an office job or a job where you're not doing as much physical activity to find ways to be more physically active. Another is hyperlipidemia. That means high cholesterol. Cholesterol can lead to the buildup of plaque in the arteries. That plaque can restrict the blood flow, and so want to manage that. That kind of stuff, and that kind of stuff can happen when you're eating the wrong kind of fats. Cholesterol will really build up if you're eating processed fatty foods. And a lot of that in the United States, that's a big problem where we live. That's a problem that I've had in my life. A lot of our food is simply deep fried in vegetable oil and everything like that. So we're not really getting any kind of healthy fat. There are a lot of animal fat that won't be as hard on your arteries and cholesterol buildup. So people might not, if it's just processed animals and animal fats, natural, it's probably not going to be as big a risk as those processed foods. Also, the other thing I think more and more, I'm studying this, is the role of processed sugars. That's highly processed food in terms of things like cholesterol and everything like that. But we want to just manage that. And again, diet. Diet is a big risk factor. And one of the things that I got stuck in this cycle here in the United States, one of the blessings that we have that's also not a blessing is we have a lot of access to highly processed foods that you can eat on the go. And I got into this habit for years. My life was so busy and I was doing so many things. And here in the United States, a lot of what I was doing required me to drive from town to town to town and place to place. And what I would do is I would drive into places like a McDonald's and drive through the drive-through and get these highly processed meals and eat them while I was driving my vehicle to the next spot. I did that for years and years and years. And because of that, it's led to me needing to lose excess weight. All that highly processed food hasn't been good for me, and I know that. And even though I know that, it's hard to stop. Well, that's what's happening, I think, especially in a lot of countries where there's an emerging economy and there's more wealth and you have more money to spend. A lot of times you can start eating things that aren't as healthy, as good a diet, and those kinds of things. Just a poor diet that leads to excess weight can lead to stroke. And that brings into another thing. It's a part of that can go, especially with eating the wrong diet, is the diabetes. And to have type 2 diabetes can also greatly increase your risk of stroke. And actually, sometimes diabetes can be a sign of it can result somewhat of high blood pressure, hypertension. They all interplay together. Another one that, last one that I want to talk about, whereas hypertension can lead to a hemorrhagic stroke, atrial fibrillation can lead to an ischemic stroke like I had. And here's what happens. Atrial fibrillation is when the top part of your heart, the atria, they just kind of flutter. And in other words, they're not pumping like they should to get the blood out through your heart and out to your body. And because they're not pumping like they should, they're kind of fluttering, what happens is blood pools in your heart instead of going through and out your body. And a lot of times what happens, you'll feel like your heart is racing, you'll feel lightheaded, and you'll feel dizzy. But if that happens too often, and if your body's in that chronic state of not working right, the heart not working right, clots will begin to build up in your heart, and then they'll end up getting out because the blood's not moving. It's going to start clotting, and then it's going to move out of your body, and some of it could go up to your carotid arteries, and there's some arteries in the back here that go to your brain, Circle of Willis, I think it's called. I can't remember. It's been a while since nursing school. I'm remembering all those technical terms. But when that happens, you may have one of those clots go up into your brain, like it happened with me, and then lodge somewhere to restrict blood flow. So atrial fibrillation is another important condition. Just like you want to get hypertension, high blood pressure taken care of, you also want, if you find that you have moments where feels like your heart is racing and you're dizzy and you're fatigued all the time, you want to get that treated. And again, as best you can, to find access to a healthcare provider, because there is medicine to help with the atrial fibrillation. The other thing is they can give you some medicine that will thin your blood, so it won't be as likely for it to clot. And those are just some important things to think about, because what we want to do is we want to stop a stroke from happening. And we want to be aware of the things that can cause strokes. And because they're so disabling, it can happen that someone would have a stroke and they will need care for the rest of their lives if they survive it. That is something I think, especially those of you who are working in communities, your pastors or other kinds of leaders, or your nurses or and others, is you want to really be communicating to your people about things like stroke and the risk of stroke, and to teach them and educate them, because the more we can educate people, even if they live remotely, even if they don't even have access to a lot of quality medical care, the best thing we can do for people is to help people know and understand what the risk factors are, so they can make life choices that would minimize the risk. The other part of it is to help people understand that what they need to do right away if they start to experience symptoms. For example, let's say somebody, it's going to be an hour travel to get treatment if they start having symptoms of stroke. There's a lot that can be done in a hospital for a stroke victim in the first 90 minutes, the first couple hours of symptoms, to minimize the damage. And the faster we can get somebody to recognize, oh, this isn't right, I'm having a stroke, or I'm having something, I need to see a doctor. Because what happens, and it happens here in the United States all the time, is people just kind of try to tough it out. And they tough it out, and they tough it out, and they tough it out. And then they come to the emergency room, and the doctor will be asking the family, how long have they been having symptoms like this? And they'll say 3, 4 hours, 5 hours, 6 hours. And by that time, there's less and less that can be done to minimize the damage for a stroke. And the thing that I saw that was interesting and promising is also the reality, and this is one of the things I'm thinking about what our organization can do going in the future, is there are increased ideas about having mobile health units. Like here in the United States, we have ambulances with paramedics and everything like that. But in some places in our country, we've had doctors who have taken a big truck and made a medical treatment facility in that truck, and then they would drive from poor community to poor community where there's no access, and they'd have all their stuff with them in the back of that truck and to be able to provide care. As I think about it, and I'm researching and looking in places like Africa, Pakistan, and other places, northern India, that there may be a way to develop a system where you have these mobile stroke units that are available to go to community to community, and to have maybe these mobile units, some way to dispatch them so they can head towards somebody who's having symptoms, and maybe just not stroke but other conditions as well. In the United States, we have paramedics, ambulances, and a lot of these things end up being in countries, the scope of practice of those providers that are on those ambulances, mobile units that will go get somebody and bring them to the hospital and everything. I mean, I think there's just a lot of things to discuss that could maybe help in the future, but that doesn't really help now. But I just want to share just some thoughts, because I really am concerned as I see and study more and more about how many places in the world people just simply don't have access to health care that otherwise could help them through a medical emergency to live a healthy life. And I do think we need to maybe think out of the box a little bit and think about ways that we can make sure that we can get treatment to people. And I do want to keep having that discussion. But we do want to try to get people to medical treatment as quickly as possible to minimize the damage. What happens when somebody survives a stroke? Well, the stroke has happened. There's been a damage in the part of the brain, And because of that damage, there's going to be some deficits. And the thing is we've got to figure out what the deficits are. There are some people that come through a stroke and they're paralyzed in one side of the body. I've seen people that have come through, they're not only paralyzed in one side of the body, if it was severe enough and they survived, they might lose their ability to communicate. They're unable to swallow and they're paralyzed on one side of the body. And this is where good palliative and care leading to hospice care comes in, because those people are going to need lifelong care, and their family members are going to need to be trained how to provide for them. In countries like here in the West, there may be more treatments, more things that are accessible to people to do that are in that state. A lot of times what happens in the United States, somebody that has suffered a stroke like that will be placed in a nursing facility to receive care from nurses and other staff for the rest of their life. But there are those that have lesser deficits. I've known some people that have had strokes and they still can eat, and they maybe walk with a limp on this. It's hard to use one side of the body, but they're still able to have a reasonably functional life. But at that point, recovery is often to teach them how to live with those deficits. How do I negotiate my life around some of these deficits that might be somewhat significant and severe? How do I live with difficulty communicating? Some people have even minor deficits like I've had, where I've got tingling in my hand and balance issues, a few things, but the deficits are minimal and I can work without restriction. But at the same time, in the aftermath of my stroke, it took some getting used to. I would have frequent falls because I was losing my balance. I had to retrain my mind at first, and if I had been doing this, the first year after my stroke, there were moments where I knew what word that I wanted to say, but I couldn't get that word out of my mouth. But over time and keep working at it, it got better, and the deficit got less. So the things that we want to help people with as they're recovering from stroke, and one of the things, if you're providing care in your community for the whole person, is you want to begin to think about providing certain kinds of care, like helping somebody who's got those deficits with mobility, with walking, with using their hands, is to work with them and help them to learn how to cope with that deficit, but also maybe strengthen themselves. We call it physical therapy, where we're trying to help people relearn and use parts of their body that and those kinds of deficits. It's really helpful, but it takes somebody to take the time to help work with somebody to get better. And that's one of the most important things to recognize if you're a pastor or some kind of leader in your community, is that when you do these kinds of things, this is a ministry, a service to the whole person. And I'll put it this way: if you have somebody in your community that's had a stroke, and they no longer can gather in your worship because they lack the mobility, the ability to get around, if you go and help them recover as best they can so they can participate again, then they won't be cut off from their community, because it is very isolating to have these chronic illnesses or chronic effects of having something like a stroke. Because of those things, it can lead to people being isolated from the community. And when people are isolated from their community, they tend to get depressed. And with that depression can come spiritual depression. to feel alone and isolated. So the more that we can do to help people manage those deficits that came from stroke and to recover as best we can help them stay engaged and involved in the community. So, and that's better for them overall, spiritually, intellectually, emotionally, socially. The whole being of a person is made, and I believe made by God to be social with other beings made by God. We're made in God's image. We're made to live with one another and fellowship with one another. And the more disease and the more deficits from something like a stroke get in the way and isolate somebody, the more problems it causes in their life. So to take care of the whole person is to help them to stay integrated with the community. And also helps with family life, because the more somebody can recover from a stroke, the more they're able to do for themselves and get towards living more independently, the less pressure and stress it's going to be on their family. Because that's also a big burden. The more you have to do for somebody and caretake for somebody, that can be a big burden. And the more we can help them get through all the deficits of their stroke, and be able to maybe walk on their own, maybe to feed themselves, maybe to be able to communicate. We have speech therapy for that. We work on relearning and saying words. And also there can be, in those speech deficits, there actually can be a language, I call it a stroke language. Somebody is trying to say words, but over time, family can begin to understand what they're trying to communicate, even though the words don't come out exactly the way, in the proper language. For example, in English, a proper English, but people begin to understand and know what that person's saying and begin to work with them to help them to be able to communicate and learn how to communicate. Communicating is a big thing. The other thing is some people have deficits where they have to relearn how to swallow. Some people aren't able to swallow and chew up food as they did, and they need people to puree food and maybe somebody in some cases may just need liquids. But learning people and helping people to learn after a stroke to recover as much as they can. One of the things I learned after my stroke, when people were talking to me about my recovery, they said the best opportunity for recovery is that first year after you have a stroke. And that first year is the year to really focus on doing all the recovery you can, because it's less likely recovery efforts are going to be effective longer than a year out. So you want to be starting right away. And that's one of the things that we want to help people in our community do and understand is when they've had something like a stroke, waiting to recover is not really a good option. And that I'll say that happened to me. My stroke was caused by a hole in my heart. It was I had a hole in my heart that the clot went through. I didn't realize this, but I had a rare clotting disorder, and so my blood clot. I didn't realize it was clotting. It went through the hole in the heart, went up to my brain, caused a stroke. Well, they needed to do surgery to close that hole in my heart. So they did the surgery to close the hole in my heart right at the beginning of the pandemic. And as the pandemic went into full force, all the heart surgery rehab in our area was shut down. You couldn't do it. You couldn't go because nobody knew what to do with the pandemic. And so I never got cardiac rehab for after my heart surgery. And that affected me because right through that pandemic, things were so limiting. There's just a lot of stuff that I couldn't avail myself of. So because of that limited me, and it did have a long-term effect. Recovery from surgery, recovery from something like a stroke is really important as quickly as possible because it limits you the effectiveness of that rehabilitation. But we do want to work towards that kind of rehabilitation because it's really important to do that. And one of the things that I think really could be helpful in your community, if you're a pastor or a leader, if you are a nurse, if you're doing things in your community to promote health and well-being in your community, is to help get involved, help people, challenge people to do the rehabilitative work after they have something like a stroke, instead of just letting them sit and let those deficits become bigger and bigger and loom bigger in their life, because it doesn't do them any good, because the more they're unable to function and to integrate with other people socially, the more withdrawn they are, and that just leads to depression and a lot of just other unhealthy things. So we do want to encourage people to engage and to work and to do the hard work to get as better as they can be after a stroke. The last thing I do want to mention is we also, and I've talked kind of about this, we also want to bear in mind that things like stroke can bring life-limiting conditions where people are dependent on others for the rest of their life. And to recognize how limiting that can be, recognize the social impact of that somebody is stuck up in a bed in a house, and how much the family has to do to care for them, how little they can do on their own, and to recognize, especially again if you're a pastor or a leader in your community, how much these people need interaction, they need support, families need support. Here in the United States, one of the things that I often see, really see, is that there are people that are caregivers, and these caregivers need breaks too. The person, their loved one, may not be able to feed themselves. They may need diapers that are changed. They can't control their bowel. They can't control their bladder. They may be up all hours of the day and night. And so a caregiver that's caring for somebody day in and day out, it gets tired, and oftentimes they just need a break. They need somebody to come in and say, I'm going to watch your loved one go rest. Here's 3 or 4 hours. Go lay down and rest. You're exhausted. You're tired. Here, go to the store. Is there something I can get for you? Is there something I can do for you? And the more we can be a community, especially as a Christian pastor, I think of the church as the body of Christ. We're all member of that same body, and Jesus is our head, and he guides us and directs us. And the more we function as a body together, the more people will see the glory of Jesus in our lives and in our church. One of the problems I think globally happens is people claim the name of Jesus, and yet it doesn't seem like he makes much difference in their life or in the life of the community. And the more we show that forth, the more powerful our words are when we talk about Jesus and his resurrection and his life that he gives us. And I would just encourage people who are watching this to be thinking about that, especially if you're a pastor or a Christian leader. And I know not everybody watching this, some of you or embrace other religions. I know that some of you may not have any religious belief at all. I'm just sharing from my perspective and who I am as a Christian pastor. But nonetheless, I also believe that God made us in his image. He made us be social beings. So even if you're not part of Christianity, you can still serve and take care of that social aspect of being of people. It's very, very important. But I would just encourage everybody to think about the opportunities that come from those who have been limited by a condition such as a stroke. And also, like I plugged earlier, the Kenya Hospices and Palliative Care Association in Africa. I'm trying to find different associations and groups. Share it in the comments below if you know them, so I can be aware of them. But I want to encourage people as much as you can to participate in those things and know about those things and bring those back to your community or meet people that are involved. Find palliative care and hospice nurses and doctors and others to talk about these kinds of things to help you develop things in your own community, because this is an important thing with people have devastating conditions like stroke where they can't get out of bed, they're incontinent, they have trouble eating, and they need comfort care. They need palliative comfort care because their life is not going to get better. Is to provide those kinds of services in a community is another important way to serve the community. So I do want to thank you all for watching this live stream. Again, I'm going to look at the comments over the next couple days. If there's a topic that you want us to talk about, to share, please say something in the comments below. I know some of you are not watching this live. I watched the trend. I'm trying to figure out time differences and everything. And so I realize that some of you will watch this hours after it's been live. I'm glad you do. But still share in the comments. Tell me what I can do, what I can, if I don't know, I can study, I can research. I have the medical background where I can kind of put some things together and try to explain in a way that's helpful to you. But just tell me where we need to go. I want this to be a community where we can really build one another up and be very, very helpful to you wherever you are in the world. So why don't you share in the comments, like I said. Those of you maybe watching in the West or you have financial resources, it would help greatly for me to upgrade our camera, equipment, all those kinds of things. So there's Stars is the program on Facebook where you can buy stars, and 100 stars is $1. All that money, it's not going to me. I have a nursing job that provides income for me and my family, but I don't have enough income to fund upgrading video equipment, making better videos and to further expand some of the stuff that we're trying to do. I don't have that ability. So if you give stars and you do that, it would just help us to be able to do that. And that's, I promise you, what I will do is I'll take those stars and I'll 100% use them to support what we're trying to do on this page. It's not going to go into my pocket to pay any of my bills for my family. I've got other income to do that. I just want to be able to help people, and this is one way I've found that I can reach across the world, across the globe, to communicate and help people, is to do this Facebook page. Also, last thing now, I just think about it, I always forget, we do have a YouTube channel, PastorChrisRN on YouTube, and you can look up and try to put videos up there, longer teaching videos on different topics, and you can check that out as well. Until next Thursday for the live stream, we pray that God will bless you and that you might have a very good day. Take care.